dynamic of the spread of the virus in the province has been blamed in the surge of coronavirus cases. In the last 7 days, the province has seen an increase of 929 active cases. This as the number of recoveries remains stagnant.
We have also enhanced our hotspot strategy. Our hotspot strategy will go beyond what we used to do before, which was testing and contact tracing and isolation or quarantining.
Cluster outbreaks are to blame in Ekurhuleni and the West Rand.
The mining sector has contributed substantially 21% of all those new cases that have occurred in our province in the last 8 days have come out of the mining cluster.
The province acknowledges that a new strategy is needed for high-density areas.
We now look at those numbers, break it down, no longer just in terms of the districts, no longer just in terms of the sub-districts. We're now taking that, breaking it down into the number of people in every ward and in every community.
A concern was also raised regarding the backlog on test results.
At the beginning of May, we said to you that we want to screen 5 million people by the end of May. We have surpassed that target. We had said to you we want to be able to test 3,000 people a day. We have surpassed that target of testing. There are days that we test over 6,000 people a day in Gauteng, just as government, and this testing is targeted. Of course, I think we are concerned, like all provinces, we are concerned with the backlog on the results.
As the country moves to level 3 next week, Monday, the risk of community infections will also increase. However, the Premier says the economy cannot continue to be shut down. The Premier has also rubbished claims that the province is not transparent in their numbers.
You can't manage a pandemic ideologically, by a party. And every state that comes out is interpreted using ideological spectacle. The numbers of Gauteng must be seen in a suspicious way. Only the Western Cape numbers must be treated as that's ideological nonsense, basically. People are dying, people are getting infected.
With all the measures in place to try and control the spread of the coronavirus, human behavior remains a key element in keeping the number of infections low, but the poor people will remain vulnerable. Nosintombi Mia, SABC News, Johannesburg.